On behalf of myself and St. Peter's Healthcare System, I would like to thank Dean Sherman and Dr. Padma Arvind for this outstanding initiative and the privilege they have provided us to address you. Clearly, a very special community here. Now to address the question of why we are here today. I'm sure we come from very diverse backgrounds. We have varying agendas, but I know what we have in common is the concern for the future of healthcare, especially here in our state, in New Jersey. What I'm sharing with you today is a simple perspective of a clinician who has practiced in this region of New Jersey for the last 30 years. During this time, the chronic disease burden in New Jersey has rapidly risen and continues to increase. Topping the list are cardiovascular diseases, heart attacks, strokes, with key risks of hypertension and diabetes, and of course, cancers. In New Jersey, as elsewhere, we notice significant health disparities in vulnerable population, especially consisting of ethnic minorities, elderly, women, children, those who are disabled and poor, usually underinsured, uninsured, or even undocumented. Projected annual costs surpass more than $100 billion as expected in next 10 years. But there is good news. The top third of it is avoidable by taking simple measures. Research shows evidence-based methods can prevent disease and can predictably decrease costs. But what we have seen is just increasing cost and increasing burden of disease. So until now, we are struggling to bring forth what we know to what we do. So what is the best approach then to translate research into reality? The secret to success appears to me to be in simply focusing on patient knowledge and patient self-care behaviors. Of course, this is easily said than done, and we know how difficult it is to stay on path of right behavior each day consistently, even when we intend to do so. There are chronic care models that give us a framework to bring the necessary changes to the health systems and our community. We need a system that is focused on informing and activating patient and family, while there is a community that is prepared to provide self-management support. As a community, we all need to step up in helping people develop self-management skills and institute policies for resource allocation for adequate self-management support. By changing behaviors in all concerned, we can drive costs lower while improving outcomes. If providers change behaviors in how they practice, if systems of care improve better healthcare utilization, and if patients can be taught to have more knowledge and improve their self-efficacy, there will be better disease control, better outcome, and that can only mean lower cost, and cost not just in dollars, but in lost productivity and self-suffering. So what is the future like in healthcare industry? We heard that the job market is booming in all sectors of healthcare, but we have a serious deficiency in skilled healthcare workers that match the current needs of healthcare. Education is very expensive, and our educational curriculum is deficient in addressing these self-management skills, chronic disease management, and prevention and preventive health. The Healthcare Talent Network that's led by Dr. Padma Arvind is trying to come together to bring us together to address these needs, to promote less costly educational pathways by using stackable curriculum skills, certificates that are worthy of college credits, on-the-job training, grants, and support to better meet current health employment needs. So please stay tuned all of this week for details on how to achieve these lofty goals. And I think we can if we just are optimistic, focused, and work on prevention and chronic disease self-management. I believe the key to achieving total health is by promoting self-efficacy, self-management with specific focus on emotional health, physical health, nutritional health, with a good understanding of disease risk awareness. Today, we at St. Peter's have created for you a model medical village to address these issues. Do you know your stress level? Do you know how it affects your health? Do you know your fitness level? Do you know how it affects your health? Do you know if you're eating healthy? Do you know how that affects your health? Do you know your risk factors? Do you know how that's going to affect your future health? If you want to find answers to any of these questions, or you want to understand pathways to becoming healthcare providers or allied healthcare personnel, please join us in our medical village. On behalf of Mr. Ronald Rack, President of St. Peter's Healthcare System, I would like to thank you and share with you our mission of over 100 years, which is still fresh and pertinent to date, in humble service to humanity, especially the poor, through competence and good stewardship of resources. Let's provide care and come together. Thank you.